award is a fantastic acknowledgement of what the whole team does and how we can serve our community when they need us. I think probably the longest day I've driven is 750 kilometre round trip to go and see one patient, and then a lot of the other time we spend sort of in Broken Hill, going out to patients' homes, seeing them in the homes with the nursing staff, seeing patients that are in hospital on the wards, visiting patients in the residential aged care facility. So every day is different, and we just go to where people need us at that time.
You know, the greatest thing about this award is that it sort of really acknowledges just how strong palliative care research is in Australia, New Zealand and around the world, and I'm just really proud to be part of that community. And I also really wanted to just take an opportunity to acknowledge Jane Phillips, who has been a great mentor. She was my PhD supervisor, and she's, you know, if you're wanting to get into research, a person like Jane is someone you want in your corner. She's been a real champion for my research career, and I think research is a real team effort. And without Jane and without the amazing support of all my friends and colleagues at Impact, I wouldn't be standing here tonight.
Well, I'm hoping it'll bring more of the spotlight in Hobart to aged care and to how maybe models of care could be changed to try and improve the outcomes of people in aged care facilities. Actually hoping to work closer with the Royal Hobart Hospital and the Tasmanian Government to come up with a way in which we can reduce the admissions of aged care residents to hospital and improve the quality of life in aged care facilities for Tasmanians.
To be honest, with all of the amazing leaders here at this conference, I feel like an imposter. But I guess what it means to me is that there is so much work that I have the potential to do. What I want to do is recognise my strengths and weaknesses and hopefully inspire other people to do really well in aged care. What I'd like to be is an example for young aspiring nurses, and in particular those who want to be nurse practitioners, because I think we've really got the opportunity to make a difference.
Honestly, I think it means that we have the chance to convince government to do better, to fund better, so that we can support people across Australia to live well and die well in aged care.
Well, I think really we were aiming to try and reconfigure the way we deliver services in a way that can meet people's preference. So I think, you know, out of a really patient-driven concept of working with clinicians and consumers and our health service, we were able to configure a service that actually achieves that.
Very excited. I didn't think I would be, because I guess you don't do this work to get an award. When you get it, it's a lovely warm feeling.